Then we'll see about the biliary causes of cirrhosis, starting with primary biliary cholangitis. So initially it was primary biliary cirrhosis. Now it is changed into cholangitis. Okay. Even though it leads to cirrhosis, the name alone has been changed. So this is also an autoimmune condition affecting predominantly females of 40 to 50 years. So middle-aged females will be affected, and here it is going to be associated with Sjogren syndrome also. So the main thing happening in this primary biliary cirrhosis is there is going to be damage to medium-sized intrahepatic bile ducts. So medium-sized intrahepatic bile ducts will be damaged in PBC. So, since it's an autoimmune disease, you'll have to check for certain autoantibodies here. So, what are the antibodies which we check for? The first one will be an anti-mitochondrial antibody. So, this is the most common antibody which we'll test for in a PBC. So, anti-mitochondrial antibodies. Then you can also have anti-nuclear antibodies and ANCA. So, ANCA is anti-neutrophil cytoplasmic antibodies. So, ANAs were also present in autoimmune hepatitis. In fact, it is the most common antibody seen in type 1 autoimmune hepatitis. Similarly, in PBC also you can get ANAs and ANCAs, but the most common one or the specific one for PBC will be anti-mitochondrial antibody. So, here again it can cause an increased risk of cancer, hepatocellular cancer, as it can progress to cirrhosis. So, microscopically if you see, there will be granulomatous inflammation surrounding the bile ductules in the portal tract along with lymphocytic aggregation. So, this is also an example of a granulomatous inflammation. Okay. Then we'll see about primary sclerosing cholangitis. We had already seen about primary sclerosing cholangitis in context with ulcerative colitis. Remember? Yes. So, here again it is also an autoimmune disease, but here this autoimmune disease is going to be common in male. So, middle-aged male it is going to be common, and it is associated with ulcerative colitis. And here the antibodies seen in this primary sclerosing cholangitis will be anti-smooth muscle actin antibody and atypical p-ANCA antibodies. So, both of these antibodies again we saw in type 1 autoimmune hepatitis. Remember, in type 1 autoimmune hepatitis we had ANAs, which was the most anti-nuclear antibodies, which was the most common antibody. Then we had anti-SMA antibodies, right? And we also had atypical p-ANCA and anti-SLA or liver pancreas antigen. So, remember, out of this, the anti-SMA antibody and atypical p-ANCA can also be present in primary sclerosing cholangitis. So, what actually happens in PSC is that there is going to be inflammation to the both intrahepatic and extrahepatic. So, both intrahepatic and extrahepatic bile duct inflammation will be there associated with fibrosis. So, as the name suggests, sclerosing is there. So, something related to fibrosis must be there. So, cholangitis means it is bile duct. So, around the bile ducts, but here it is going to be both intra and extra hepatic bile ducts, around which you will have inflammation progressing on to fibrosis. So, here it is associated with bile duct pathology, and there is going to be an increased risk of cholangiocarcinoma. So, on microscopy if you see, around the bile ductules you can see onion skinning fibrosis. So, if this was the bile ductule, around this fibrosis will be seen in a whirling pattern called as onion skinning fibrosis associated with lymphocytic infiltrate. So, on radiology also you can see a chain of beads lake appearance. Okay.